I'm a CEREC dentist, and I was out at the CEREC doctors down in Arizona, Scottsdale, and I met Anthony, my rep, and you know, being a rep, do you believe what they say? So I went and started talking to other CEREC dentists, and they just couldn't stop raving about LANAP, LAPIP, that how can you practice without it? So I ended up incorporating it into my practice. I think it's the best thing I've ever done. And then we started doing LANAP. My mother was my first patient. And you know, my rep told me that there is not much pain after. And my mother, who does not like going to the dentist, even though her son's a dentist, said, well, there better not be any pain. And I'm thinking to myself, boy, I sure hope there's no pain. And I did the whole LANAP full mouth protocol, and I called her that night, no pain. Do I have to take the Advil? So I knew I was onto something pretty good. And I used to do a lot of flap traditional osseous surgery, and so I know that end of it. I'm not a periodontist, and but doing the LANAP post-ops has got to be the biggest impact for me. The patients have no pain, and they're going, when are we doing the other side? Traditional osseous surgery, you'd be lucky to see the patient back after one quadrant. It's almost, I call it medieval, because I've never want it done to myself. And all my patients that I've given the option, I haven't had one patient that's actually gone for the traditional osseous surgery. Pretty powerful. I have a very large practice, so I didn't really do much advertising for LANAP because I wanted to give everybody that's been with me, stayed with me, first dibs on this technology. And it's quite amazing the patient referrals I get from one of my patients I've seen for years, never saw their mom or friend. Now word's getting out and they're coming in, and whether or not they need LANAP, now I've got a new patient. I've had one patient that was so excited about the LANAP because they had had traditional gum surgery done, and he referred 6 full mouth cases to me from one patient. Because I think if your dental school does not have LANAP as a protocol in training, you're behind. You're already going to be behind the 8 ball. And if you're trying to attract new periodontists, say, to your school, you better have this technology. Yeah.